A miscarriage, or spontaneous abortion, is defined as a pregnancy loss that happens without outside intervention before the 20th week of pregnancy. Pregnancy is so complex that there are many different ways for the process to get off course and for a miscarriage to happen. For example, if there's a chromosomal abnormality in the sperm or egg, then the resulting zygote will have a problem. One of these problems is called aneuploidy, which is when there are missing chromosomes, or additional chromosomes. For example, if there's one member of a chromosome pair missing, that results in 45 chromosomes total, instead of the normal 46, and it's called monosomy. And if there's one extra chromosome joining a pair, that results in 47 chromosomes total, and it's called a trisomy. Some types of aneuploidy are viable, like Turner syndrome or Down syndrome, whereas many are not, and can lead to a miscarriage. Another abnormality is polyploidy, and that's when a zygote receives more than one set of 23 chromosomes from either the sperm or egg, resulting in 3 sets, totaling 69 chromosomes, or even 4 sets, totaling 92 chromosomes. Polyploidy is generally not viable, and leads to a miscarriage. One more abnormality is a translocation. It can either be balanced, where 2 non-homologous chromosomes essentially trade equal amounts of DNA, or unbalanced, where the chromosomes exchange unequal amounts of DNA, resulting in either too many or too few copies of certain genes on the involved chromosomes. Now, even if a parent carries a balanced translocation, the sperm or egg might end up with an unbalanced translocation, and the zygote won't have a normal number of genes. Some translocations are viable, whereas again many are not, and can lead to a miscarriage. Now, let's say that there are a normal number of chromosomes present, and that the zygote becomes a blastocyst and tries to implant. There are still many ways in which a miscarriage can happen. First, if the blastocyst fails to implant into the endometrial lining of the uterus, then it won't find a blood supply, and it stops growing and gets reabsorbed. Secondly, if the blastocyst implants in tissue other than the endometrial lining of the uterus, like the fallopian tube, it's called an ectopic pregnancy. In the majority of cases, ectopic pregnancies won't have the space or blood supply necessary to support a developing pregnancy. As a result, the blastocyst stops growing and is reabsorbed. If the blastocyst does implant in the endometrium and continues its development, it relies on the corpus luteum to maintain the pregnancy. And one hypothesis is that a miscarriage can happen if the corpus luteum fails to secrete enough progesterone. Finally, as the pregnancy continues and the placenta develops, the fetus starts to rely on the placenta to maintain the pregnancy. If the placenta is unable to secrete sufficient levels of hormones or provide the fetus with a sufficient blood supply at any point, the fetus can stop growing and a miscarriage can happen. During the embryonic period, which is between the 3rd and 8th weeks of pregnancy, the fetus is especially vulnerable to damage from teratogens, which refers to anything that disturbs normal development, potentially resulting in a birth defect or death of the fetus. The list of environmental teratogens is long. It includes things like medications, like isotretinoin, as well as alcohol, recreational drugs like cocaine, tobacco smoke, and heavy metals like mercury. Vital organs like the heart and brain are developing quickly during the embryonic period, and teratogens can cause them to have severe abnormalities. Between weeks 10 through 14 of pregnancy, chorionic villus sampling can be performed to assess the growing fetus. That's when either a needle or a catheter is used to grab a small sample of the placenta, so that a genetic analysis can be done on fetal cells from the placenta. Around week 15, amniocentesis can be performed instead of chorionic villus sampling. That's when a needle is placed into the amniotic fluid to pull out some fetal cells. These procedures are usually well tolerated, but they both have a small risk of causing trauma and introducing an infection, both of which could lead to a miscarriage. Other traumatic causes of miscarriage include motor vehicle accidents and accidental falls. As the fetus grows throughout the pregnancy, uterine abnormalities can also become an issue. For example, if there's a septate uterus, which is where there's a septum or a thin flap of tissue within the uterine cavity, or if there's a submucosal leiomyoma, also called a submucosal fibroid, then it limits the amount of space available for the growing fetus, and this can lead to a miscarriage. In addition, bacteria like Listeria monocytogenes, protozoa like Toxoplasma gondii, or viruses like cytomegalovirus and herpes simplex virus might infiltrate the uterus or pass through the placenta to get to the growing fetus. A severe fetal infection can lead to a miscarriage. Finally, various maternal diseases can also affect the fetus. This includes obesity, endocrine disorders like diabetes mellitus, thyroid dysfunction, or PCOS, which stands for polycystic ovary syndrome, immune system disorders like antiphospholipid syndrome or systemic lupus erythematosus, which can also increase the likelihood of blood clotting, and high blood pressure, which damages the blood vessels, including those of the placenta. Increasing age of either parent is also a risk factor. The diagnosis of a miscarriage is based on the stage of the pregnancy. A threatened miscarriage or threatened abortion is what it's called if there's bleeding from a closed cervix, and an ultrasound confirms the fetus is viable. This happens quite commonly in pregnancy, and most of the time it does not result in a miscarriage. Next, there's an inevitable miscarriage, which is when bleeding comes from an open cervix. This is typically accompanied by abdominal cramping pain, and uterine contents, like the placenta or fetus, are often visible during pelvic examination. After that, there's an incomplete miscarriage, which is when the uterine contents have begun to pass through the open cervix. If the uterus becomes infected during this process, it's called a septic abortion. That infection can spread from the genital tract to nearby structures in the bloodstream, resulting in a potentially life-threatening situation for the woman. Finally, a complete miscarriage is when the uterine cavity is empty and the cervix is closed once again. Now, there's also something called a missed miscarriage. And that's when the fetus is no longer viable, but the cervix has not opened to allow the passage of the placenta and fetus. A missed miscarriage can happen with or without symptoms like bleeding or pelvic pain. Symptoms of a miscarriage depend on how far along the pregnancy is. A miscarriage in the first few weeks of pregnancy might go completely unnoticed, or might result in a relatively small amount of vaginal bleeding with or without the passage of embryonic material that appears like blood clots. As the pregnancy gets further along, miscarriages are more likely to produce lower abdominal pain and more vaginal bleeding, and passage of placental and fetal tissue, which are called products of conception. Diagnosis of a miscarriage can be done using a transvaginal ultrasound, pelvic examination, and laboratory tests like measuring the serum HCG levels to determine whether it's appropriate for the gestational age. Treatment of a missed, incomplete, or inevitable miscarriage might include expectant management, which involves close monitoring while the miscarriage goes to completion without medical intervention. Sometimes medications like misoprostol can be used to induce labor, or surgical options like dilation and curettage or uterine aspiration can be done. A complete miscarriage typically requires no medical intervention. Treatment of a septic miscarriage might involve antibiotics and surgical intervention. In many countries, women whose blood type is Rhd negative and who do not already have anti-D antibodies in their blood are given Rhd immune globulin when they have vaginal bleeding during pregnancy, or soon after the diagnosis of a miscarriage. This prevents the development of antibodies that can cause harm to future pregnancies. Lastly, social and mental health support are crucial for anyone affected by a miscarriage. Alright, as a quick recap. A miscarriage, or spontaneous abortion, is defined by many organizations as a pregnancy loss that happens without outside intervention before the 20th week of pregnancy. There are many known risk factors, including chromosomal abnormalities, teratogen exposure, increasing parental age, physical uterine abnormalities, autoimmune disorders like antiphospholipid syndrome, and severe trauma. A very early miscarriage might produce no noticeable symptoms, while vaginal bleeding and lower abdominal pain become more common as the pregnancy progresses. Treatment might include expectant management, surgery, or medications to induce labor.